Today we are covering fluid and electrolyte balance, specifically how to choose the correct intravenous fluid for a patient on the NCLEX. This topic is all about understanding tonicity, which is the effect a solution has on cell volume. The exam will give you a clinical scenario and expect you to act as the nurse by selecting the appropriate fluid. Let's start with isotonic solutions, like 0.9% normal saline and lactated ringers. These fluids have the same osmolality as blood plasma. The key exam concept here is that isotonic solutions primarily stay within the intravascular space, making them perfect for expanding volume. A classic NCLEX question will describe a patient with signs of fluid volume deficit, perhaps from vomiting, diarrhea, or hemorrhage. They'll have tachycardia, hypotension, and poor skin turgor. Your first-line treatment is to administer an isotonic solution to rapidly increase their blood pressure and restore perfusion. A great way to remember this is the phrase, isotonic solutions stay where I put them, meaning they stay in the vessel. Now let's move to hypotonic solutions, such as 0.45% normal saline. These fluids have a lower osmolality than blood. This causes fluid to shift out of the blood vessels and into the cells, causing them to swell. A common exam scenario involves a patient with diabetic ketoacidosis. While their initial treatment for dehydration is isotonic fluid, once their blood sugar is under control, they may require a hypotonic solution to treat the intracellular dehydration that occurred from the prolonged hyperglycemia. Here is the most critical safety trap the NCLEX will test you on. You must never administer a hypotonic solution to a patient with or at risk for increased intracranial pressure, such as a patient with a head injury. Giving them a hypotonic fluid would shift fluid into the already swollen brain cells, leading to catastrophic cerebral edema and herniation. Instead, for those patients, we use hypertonic solutions, like 3% or 5% saline. These fluids have a higher osmolality than blood, which pulls fluid out of the cells and into the intravascular space. In a patient with cerebral edema, a hypertonic solution is a life-saving measure. It effectively shrinks the brain cells, reduces intracranial pressure, and buys time for definitive treatment. The exam will test your understanding of this by presenting a patient with a declining level of consciousness after a head trauma and asking for the indicated fluid. Another exam trap involves the administration of hypertonic saline. It must be given slowly, through an infusion pump, typically in an intensive care setting. Rapid infusion can cause osmotic demyelination syndrome, a severe neurological complication. Finally, be wary of choosing lactated ringers for certain patients. Although it is isotonic, it contains potassium. Therefore, it is often contraindicated in patients with acute kidney injury, chronic kidney disease, or hyperkalemia, as their bodies cannot excrete the extra potassium. The NCLEX loves to test these specific contraindications. Success on these questions comes down to identifying the patient's core problem. Is it a lack of circulating volume, dehydrated cells, or cellular swelling? Match the fluid to the problem.